When you look at the CLL population, we're looking at a patient population with a median age of 68 to 70 at the time of diagnosis. Many patients have comorbidities, which includes cardiovascular comorbidities. So it's important to remember a few things about using BTK inhibitors as a class in patients with CLL. BTK inhibitors are the most important class of anti-CLL drugs. So we would like to make sure that we keep that option open for our patients with a CLL diagnosis. For example, despite the fact that atrial fibrillation is a known class side effect with the BTK inhibitors, and we know that the rate of atrial fibrillation is lower with Acalabrutinib and Zanubrutinib compared to Ibrutinib, having an AFib history is not a reason to exclude a patient from receiving a BTK inhibitor. Patients could be treated for atrial fibrillation with medications that would control their heart rate or rhythm, and they could safely be on new anticoagulation drugs, except for warfarin, and we have those patients in clinic and we're monitoring them and there's no problem. I would say that in patients who have structural heart disease, concerns for heart failure, or non-atrial fibrillation dysrhythmias or arrhythmias, we definitely need help from our cardiology colleagues to make sure that a detailed assessment of patients' risk is done before initiating BTK inhibitors. Many times our cardiology colleagues optimize the cardiac situation or give us the green light to move forward. And there are, of course, patients who have cardiac conditions that for them BTK inhibitors may not be appropriate. But we definitely want to work with cardiology colleagues who are specialized ideally in taking care of patients with cancer. Lastly, hypertension or high blood pressure is also a known side effect for the class of BTK inhibitors. That is a problem with Ibrutinib. In a head-to-head randomized trial, ELEVATE-RR, the rate of hypertension was lower in Acalabrutinib compared to Ibrutinib. So in patients with refractory or difficult to control hypertension who need BTK inhibitor, the consideration to use a BTK inhibitor like Acalabrutinib should be given.